Welcome to America's Heroes Group.
Welcome to our military heroes and their families, America's Heroes Group Roundtable with partner Jesse Brown, VA Works. Today is Saturday, July 10th, 2021, and our host is the illustrious and the governor of talk radio, Cliff Kelly. I am his co-host, Colonel Dr. Damon Arnold. Our executive producer is Glenda Smith, and our digital media producer is Ivan the Great, Ivan Ortega, Scouts Honor Productions. Today's topic, we have a panelist with us who has an extensive history of getting involved with the psychological issues that people run across. Dr. John Korpics is a psychiatrist and director of mental health services at the Jesse Brown VA here in the Chicagoland area. Our discussion will cover the mental health aspects of the post-pandemic transition. We're all coming out of a tough spot, so it's good to have people who are in the healthcare field, who are in our VA system, such as Dr. Korpics, who has an idea of what this whole thing's about and why we should be paying attention to this transition. Okay, Dr. Korpics, how are you doing?
Very good. I'm very happy to be here.
Oh, fantastic. Fantastic. So what can you tell us about this? What should people be focusing on in the post-pandemic transition? We have gone through so many things, isolation and separation and not going to funerals, not being able to see loved ones and traveling. What should we know about this and how this affects us?
Well, yeah, certainly it's been stressing for all of us. And, you know, within the population of, veterans that I see, we've seen increasing rates of substance abuse and depression, anxiety. But, at the same time, coming out of this, I think there's a lot to be optimistic about and hopeful and an opportunity to move on and grieve in healthy ways and, get back connected to our communities and connected to, mental health treatment for my patients and, put some of those challenges behind us.
Great. And, what are the major things you're seeing? Because I know there are different things out there, such as, schizophrenia, but we also have people who are taking care of people with dementia and Alzheimer's disease. And, the caretakers are always the ones that have a burden on them as well. But what's the kind of a picture of what's going on? We do have people still trying to grieve from the loss of family members. So it's kind of a mixed bag out there. And then we also have a veteran population. Many of them are suffering from post-traumatic stress disorder and have other ongoing health concerns, chronic medical conditions. So how does this all figure out? How do we start to even address a problem like this?
Well, I think there's a multitude of problems you just mentioned. Something that I think of, that you mentioned is, being a caregiver for an elderly family member or someone you love. And the Veterans Affairs has been fortunate to roll out new access to caregiver support and a new caregiver support program with increased eligibility for those who care for our veterans and giving them additional resources. One of those include mental health counseling within my department that's provided free for eligible caregivers. So we're trying to provide more services for our veterans and wrap around and engage the whole family in their mental wellness.
Okay, great. And, a lot of people actually have been going through this. Some people have lost their jobs. And, so maybe you can explain to us a little bit about, the difference between people who are like in situations or situational depression, and then people who are, have a, chemical imbalance. Sometimes people say that exists. What's the difference between these things, and what do people need to know about the relationship behind being depressed because of what's going on around you, and if it lasts too long, what are the implications of all of that?
Mental illness is a biopsychosocial problem. So, it's multifactorial. It's not just a, genetic disorder that you inherit that causes a chemical balance. It's a, interaction with your environment and your stressors and, opportunities to build resilience or missed opportunities to build that resilience, exposure to trauma, and different things that can bring about, mental illness regardless of what genetic predisposition you had early on. So I think, the important thing is not to feel stigmatized about seeking treatment and admitting, you're not okay. It's okay to not be okay, and to get help, and, lots of help is available out there.
Yeah, that's a very important point, because sometimes we are afraid because we think this is such a thing that it's okay if you have, diabetes, if people feel that's outside of your control, and people feel that, high blood pressure is outside of control, which is not totally true. It has a lot to do with our diets and how we take care of ourselves in general. But when it comes to mental health, people always have a tendency to stigmatize that and sort of push back that, this is not something that will happen to me. And that can be really dangerous for them, right? I know that, veterans still have a big issue around suicide. And we know that suicidality during the pandemic period actually increased from what I've been seeing. So how can we get over this stigma? How can family members talk to people within their families to say, look, this is not you. There's something different going on. Is there anything they can do, any resources they can reach out for?
Well, certainly I would highlight the National Alliance for the Mentally Ill, NAMI. They provide a lot of resources for families when they're dealing with a loved one who's struggling to get into treatment and overcome that stigma. They have a very helpful website that's worth checking out.
So they just Google National Alliance for the Mentally Ill. Okay.
Mm-hmm. Yeah, or NAMI.
NAMI. Okay. So it's probably something like NAMI.org or something like that, right?
Right. Yeah. Sorry, I don't recall it off the top of my head.
Right.
But coming back to what you were saying earlier, I think of mental illness just how you were describing, hypertension or diabetes. Mental illness is, for the most part, are conditions that need to be, maintained. You need to maintain your wellness and your recovery. And if you lose track of those healthy habits, or, some people need to take medications for those conditions. And if you don't stay on track, then you relapse a little bit. Your symptoms come back. Your depression gets a little worse. Your anxiety gets a little worse. Just like your blood sugar or your blood pressure can go up when you don't maintain that same wellness and those healthy habits.
Okay, because you were appointed at the University of Illinois, and then in Chicago, and also Northwestern. And I know you're a fellow of the American Psychiatric Association as well. So really, pretty impressive background on this, and working with veterans for over 15 years. So as we're going through this pandemic and coming out of it, what is it that, in particular, we need to think about for veterans? Because one of the things that stuck on my mind, Doc, is that, people who are our Gold Star family members, those are members who have people who have died in the line of service. And in the post-pandemic time period, some of our service members have died during that time period, even during the pandemic. They're serving overseas, combat missions. We have returning veterans coming back from Afghanistan now. What should we be prepared for in this post-pandemic period? Because it seems like the veterans are going to have some additional issues to deal with. I was talking to some people who are in the faith-based community, and they are concerned because they're wondering if they have enough resources, because normally they would have some contributions to the mental health arena, and directing people to psychiatrists and psychologists and social workers. But they are kind of afraid because they don't know what's coming at them. And what's going to be happening once they reopen their faith-based institutions, whether it's a church or a synagogue or a mosque. So, what should we be thinking about as we're coming out of this from the mental health perspective? Should we be preparing for this and having more of a network system or integration of services, or how do we contend with this, and especially for our our veterans who are returning and the families, as is mentioned, the Gold Star and the Blue Star families?
Building coalitions is exactly what the VA is looking at trying to do right now. Trying to approach, this, an epidemic of suicide among our veterans from a public health perspective, where we can, reach out to veterans and engage them where they are. But you mentioned faith communities earlier, and depending on how you look at it, arguably the majority of mental health treatment in our country is provided in the context of those faith communities. But they need not be concerned about lack of resources, because VA is very well equipped to care for our veterans and has plenty of resources available. Our challenge is generally getting the word out there, and which is part of why it's my pleasure to be here today, to get veterans into VA and engaged in treatment and overcome some of the stigmas out there, not just about engaging in mental health treatment, but engaging with VA, which is a tremendous mental health resource that I don't think a lot of people recognize. But in terms of the veteran suicide rate, 2/3 of those suicides occur among veterans that are not connected to VA treatment. So one of the best things we can do is just get veterans to come in the door and meet with us and see all that their benefits have to offer.
Yeah, so that means that there's a big pool of people out there that could potentially be saved, right?
Absolutely.
Yeah, that's a huge number. 2/3 or something like 66%, right, of veterans. For people to really realize that. I'm just writing this down because I think this is really important to bring out. But also maybe you can tell us what, and this is the topic I've been talking to people about. And my wife was actually walking on a path one day, and it was about a week ago, and she ran across someone who was a triathlete, and this lady, was the preeminent athlete, right? Everything she did was eat cornflakes to run, right? And so she was really a big athlete. And when she walked up to her, she said, 3 months ago I could have gotten a COVID shot, and I decided not to. So as a result, I ended up in a hospital for 4 weeks and had lung involvement. They put me on a ventilator. And now that I'm off the ventilator, I can barely make it around this track once. They said I have extensive lung scarring, and this is probably going to be with me for the rest of my life. She said, what a terrible mistake I made by not getting vaccinated. So the mental health implications even for that and with her, because we always just think about the physical, and I was mentioning this one the other day, is that we wear a mask, we wash our hands, we physically distance. And I hate the term socially distancing because it implies abandonment or isolation or separation, disconnection. And what she said was, it really struck me because the mask doesn't protect you from these pressures that come from outside that have a psychological impact. So as we were talking about the public health measures, there was very, very little said about the psychology part of this and how people, would contend with being in the middle of a pandemic. So, as we're coming out of this, what do you think are the essential things that we need to be talking about? What is stress? How do people contend with depression?
Well, I think the thing to think about is how to build resilience, within yourself and with your community. And I like the points you just made about, physical distance isn't the same as social distance. And there are opportunities to still, stay connected to those you love and those you social with and those that help you build that resilient social network that can, recognize when you're not yourself, you're not more irritable, you're not sleeping, and can draw attention to these things and help you cope and help you, talk about some of these things or advise you get a little more help when it's something, more than your family or your community unit can handle without some, professional intervention.
Oh, right. And you also, when you were saying that, I was just thinking, the VA is also, I guess I'm not sure if it's the originator, but definitely the major supplier of telepsychiatry, right, and telemental health. And that is something you've been using extensively also, right?
Yeah, we were well prepared going into the pandemic, having been doing this for many years and not having to deal with some of the obstacles that other, private healthcare systems deal with in terms of state borders and insurance companies. We saw it was the right thing to do for our veterans and have been doing it for many years. But everyone else, caught up pretty quickly. And, we see most of mental health treatment, being provided virtually. What we're trying to do now at Jesse Brown is be able to maintain the veterans' preference about how they choose to engage, because we see some veterans that, we're certainly itching to get back and be face-to-face in their groups and see their fellow veterans in person. While, there's still, many that are hesitant to come in and prefer the convenience they have now of being able to engage virtually. So we're about a third in person, a third by telephone, and a third by what we call VA Video Connect. That's our video conferencing platform. And it'll be interesting, how those modalities, are used going in the future as people get more comfortable being around others and easing out of, this isolation we've been conditioned to accept over the past year.
Fantastic. I mean, those are some really great opportunities. As usual, we start running out of time. It seems like we just started to talk. And we're getting close to, we have about 2 more minutes to go. But I would like it if you could give, first of all, to give some of the numbers that people can call or a website that people can go to find out more about these services. And then, I'm going to reach out to you. I'm going to talk to Galinda Smith. If you don't mind, I'll give you a call and talk to you about I'm working with the Department of Public Health right now. I used to be the former director, but we're working on some projects with this reach out for mental health and the Ambassadors Program. And I know suicide prevention is one of their, central themes right now. First Lady's Health Initiative, about 102 churches are involved in that. But that would be a great place for you to talk about the VA benefits, because we have a lot of our veterans, involved with these institutions. So
that would be wonderful. We're always looking to build our coalitions and engage more veterans in the Chicago area.
Oh, great. So where should people go if they want to find out more about these services? If you're a veteran out there and you just feel like, or you're a family member of a veteran that says that, they need to have care, because sometimes the family members are aware of things and they maybe can guide people towards, getting the care.
Yeah, let me give you a few resources here.
Okay,
so Jesse
sure.
Brown's homepage is chicagova.gov. That's chicagova.gov. And our main phone number is 312-569-VET, VETS, or 8387. The mental health service is available at 312-569-7225. And the Veterans Crisis Line is a national service available all hours of the day, morning, noon, and night, as 1-800-273-8255.
8255. Perfect. So it's chicagova.gov, 312-569-VETS, VETS. That's 8387. And also 312-569-7225. If you are out there and you need services, please call this great psychiatrist, Dr. Korpics, and his team, and get the necessary you need for yourself. And think about this. It also helps your family. And if you're a family member that has a veteran that needs these services, please reach out or help them to reach out and seek these services. So thank you once again, Dr. Korpics, and I will be reaching out to you. And we're going to be going to a commercial break. So stay with us, and have a wonderful weekend, Dr. Korpic.
Thanks so much. My honor, my pleasure.
Okay, great. Thank you.